hospital and I go upstairs. They try to put me on a monitor, and bless my nurse's heart, she put me on a monitor, but I went straight for that labor ball that was in the room, and I stripped my clothes off and I went on the labor ball. And she was fine with that. I mean, she was like, get in a position that's comfortable, and, so yeah, so she just got all my information, and then she, told me that she's going to call the midwives to let me know that, to let them know that I was there at the hospital. At that point, my contractions honestly were still good. I was able to talk during a contraction, but it was like small answers, like yes, no, babe, get my iPod, something like that. Just small statements. But when I wasn't having a contraction, I felt great. Like, I felt fine. It was during the contractions where I felt like I needed to kind of focus. So once my midwife comes, it was probably around 9:30. My midwife comes. She's talking to me. She's like, you look really comfortable. She's like, I don't really think you're in active labor, but she's like, I do want to check to make sure that was your amniotic water that you had been feeling over the course of the evening. And she's like, I want to check that. Now, she's like, if that is positive, and depending on, how far along you are, then you're going to go home. You're going to stay here. But if it's negative, you're going to go back home. And I knew I was in labor. I mean, I was just like, I know I'm in, labor. And so, so she told me that, she said that I looked too comfortable to be what's considered active labor, which means you're about 4 to 7 centimeters is active labor. And so she was thinking, you look comfortable still, you can still talk. So she's like, you're still in the beginning stages of labor. So I was like, great. I was like, I didn't want to be only 1 centimeter. And so, she checked my amniotic water, and she originally said that was negative, that I had not experienced any water breaking. I asked her to check it again, but this time I wanted her to check my panties, because I had been wearing a panty liner, and so I wanted her to check that. So she checked that, and that did come out positive. And so once again, she encouraged me that I may not be in active labor, but she said, I'll go ahead and check you. At this point, I'm 39 weeks and 4 days. My midwife practice, the way that they practice, is that if you're a first-time mom, they don't check you to see if you're dilated or have any cervical changes until you're 40 weeks. So this whole time, I never knew how far along I was. At 38 weeks, at 39 weeks, none of that. So I asked if they can please check me, and they checked me, and with big eyes, they were like, you are 6 centimeters and 100% effaced. The baby's still a little high, probably like a -1 station, which means she hasn't really dropped a whole lot. She's still kind of up there a little bit. And so they're like, you are active labor. And I'm like, thank you, God. I was like, that was just my biggest fear. I was only going to be out of 1. But yeah, so once they checked me, I was 6 centimeters, 100% effaced. That's when things really started to progress. So, and things started to change too. At this point, my contractions were great, honestly. Nothing that I felt like I couldn't handle. But this whole time when they were checking my water, they were checking my cervix and all that, I was on my back in the hospital bed. And at that point was when I started having a lot of back pain. And I started having what they call back labor. And so with back labor, what that is when the baby is sunny side up. So the back of my daughter's head was against my sacrum. So you really want it the other way. So every time I would have a contraction, when the uterus was tightening and pushing down, I would be feeling my baby's head on the back of my pelvis, going down this way. So I was having a lot of back labor. I would turn to my left side, and it helped a little bit, but I had my husband do a lot of counter pressure, and really, honestly, that really didn't help at that point. My husband later told me that he could actually, when I would have a contraction, he could actually see my daughter's head pressing on my pelvis. He could actually see my pelvis going kind of like out a little bit, I guess. And then when he was putting counter pressure, he could feel my daughter's head pressing back against him, pressing. So I definitely felt that, and I think that kind of freaked him out a little bit too. I told my husband, I was like, you know what? I was like, these contractions are going really hard. Like, I'm having a lot of back pain, and it is like shocking. It feels, I can't even say it, the pain is just so sharp, and almost knocks the wind out of you practically. And I just told my husband, I was like, I think I'm going to have an epidural. And me, at this point, I started to search my feelings. I'm like, hey, how do I feel about having epidural? Like, am I okay, not having this natural birth that I really wanted? And, at that point, I was like, I'm okay with that. It wasn't like a big ordeal for me to give up. I was like, I'm okay with that, honestly. I want to be comfortable. I wanted to be able to enjoy my labor process, but I want to be able to be comfortable. And even though I know I'm at a 6, almost a 7, I just don't know. I mean, I could still be like this for 3 or 4 hours, and I just didn't think I could do that, to be quite honest. So when my midwife came back into the room later that morning, I told her, I was like, I think I might need an epidural. I'm like, my back labor really hurts. And so that's when she suggested. She was warm and welcoming. She was like, that's an option for you to have an epidural. But she's like, let's change your positions a little bit, because she's, she's up against your spine. So we changed my positions. I then went I was still on my left side, but what I did was I extended my top right leg, and I extended it over the side of the bed. So it was like dangling on the side of the bed. And my hips weren't necessarily on top of each other like this. They were more at an angle like this. So with that angle, it helped my daughter to turn. So at some point, I was probably in that position for maybe about 30 minutes, and I felt my daughter turn. And then at that point, I moved from being on my side to being on my knees on the bed, and then the head of the bed went straight up like this, like on a 90-degree angle, and I just hung my top of my body over the bed. And with that, it elongates my body, and it encourages my uterus to kind of do what it needs to do. And at that point, it's all gravity at that point. My baby's hanging down, and she's being able to get further down into my pelvis and into the birth canal. So once that happened, my back pain immediately alleviated. I did not have any of those back labor. The contractions did not feel painful anymore. At that point, I felt pressure all from the top of my uterus, the top of my stomach. I felt all this pressure just pushing down. With every contraction, it just felt like down. And the contractions got stronger and more intense. And I noticed that as I was contracting, I was over the head of the bed, and I would just kind of go down with it, and I would almost kind of be like in a squatting position on the bed. And when the end of the contraction would happen, I would return back to the top of the bed. And that felt great. I also noticed as my labor changed, I felt like I needed to bear down. I didn't feel like I needed to push, but I felt like I needed to bear down with the contractions. And helping with that, I also felt like this natural instinct to kind of groan. I was a groaner with my labor, and it just felt good. It felt like relief, and it helped me to kind of not necessarily become one with my body, but it felt like I needed that process to groan in order to progress in my labor. If you're a groaner, you kind of understand. So I kind of did that with my labor, and it just felt good. It also felt like I was able to be an active participant in my labor, because up to that point, it was all passive, really. But able to groan and to start to bear down a little bit, I felt active. One point around 11 o'clock, I felt like I needed to use the restroom. When I used the restroom, once again, I was in that squatting position, and so I felt my daughter dropping more, and I felt like, okay, she's definitely getting down there. I definitely feel a difference. And then as I walked back to the bed, I just felt tired all of a sudden. I was just like, I started to get kind of whiny. I was kind of whiny, and I was like, ugh. I remember talking to my midwife, and I was like, oh, is this ever gonna end? I'm like, am I gonna have a baby today? I'm just exhausted. And she was like, Mary, she was like, you're gonna have a baby real soon. She's like, she's like, I think we'll be able to order lunch. At that point, I looked at the clock, and it was 11:30, and she was like, she said I could order lunch. I was like, I'm gonna have a baby like in a couple hours, like in an hour. So at that point, I was like, oh, I'm all in now. I was like, I can totally do this. And sure enough, when I went back onto my knees on the bed, and I started to feel, at that point, did I go back on my knees? At that point, I wanted her to check me again because I just got tired. So I wasn't on my knees anymore. I was back on my left side. And I asked, I was like, can you please check me? Because I was like, I feel like I'm like really there. And sure enough, she checked me and I was at 10 centimeters complete.